Alrighty, time for the town meeting program for Wednesday, April 29th, 2020. I'm J.R. Lewis. Glad to have you with us on KLAM or on YouTube if you are hearing our delayed version of the program there. And whether online or on the radio, we are pleased to have the support of Cordova Wireless Communications, which not only provides our show, but also assures you that when you are a customer of theirs for cell phone or wireless data services, the money that you invest in those services stays here in town and recirculates through our economy. Particularly important given the state of things. And we're going to begin today, speaking of the state of things, by hearing, in case you missed it, the presentation yesterday by Mayor Copeland, which was on the city's YouTube channel live at 4 p.m. Remember, they've gone to Tuesdays and Fridays at 4 p.m. for a YouTube briefing. And we like to make sure that our audience, anybody that might have missed that when it happened, gets a chance to hear that. So let's start right there. And then afterwards, we'll take a look at what's coming up with the special council meeting today at noon, and some information from Dr. Zink about being outdoors, and some job opportunities and other things. Right now, though, Mayor Copeland, this is his presentation from yesterday.
Okay, good afternoon, Cordova. Just so there isn't confusion about my mask, City Hall is closed to the public, and there's only one person in the room here 30 feet away from me. So to have better access to the mic, I lower my mask for a few minutes here. Today, I'd like to share some updated information on signage in the harbor, mutual aid agreements, and the paid and volunteer positions to support the city's response. The testing update, as of Monday afternoon, we had conducted 28 tests. There are 0 positive results, and there are 6 awaiting results. We have a total of 905 tests available to the community, and more tests have been requested. So we do have some new announcements. As part of our city's emergency rules, all vessels and essential businesses must sign mutual aid agreements to operate with this in the city of Cordova or its waters this summer. I wanted to give you a quick update on this. We've processed more than 45 mutual aid agreements so far. We're working to streamline that process. And so far, I'm proud to report that businesses and vessels are doing a good job on this. We're working with other communications materials for vessels, businesses, and residents to make quick reference checklists. Once these quick reference materials are available, there will be a more visible presence in the community. Another visual presence will be seen around the community soon. The city is hiring support positions to help keep our community safe. We need ports of entry ambassadors to greet incoming people to Cordova. We're looking for knowledgeable individuals who can physically distribute information and resources available to those newly arriving to Cordova, including addressing the state and local mandates that are currently in place. Hazard pay for these positions is going to start at $25 an hour. We're also hiring for custodians to clean and disinfect the city's public restroom facilities in the harbor and the Bob Corn Memorial Pool. Hazard pay for those positions will start at $30 per hour. You must be at least 18 years old and have a valid driver's license to apply for either of these positions. You can go to www.cityofcordova.net for further information. Just click on the How Do I tab and then scroll down to the Find a Job slot, and that can take you to the information. You can also call City Hall at 424-6200 for information on those positions. In addition to paid positions, we're collecting information from volunteers. If you'd like to volunteer your time and support our city's emergency response, please go to our COVID-19 website at covid19.cityofcordova.net. That's COVID, the numbers 19.cityofcordova.net. There you'll see a volunteer interest form. This will help us coordinate the efforts of volunteers on behalf of the community as those needs arise. On behalf of the city, I'd like to extend a big thank you to the volunteers who have been greeting planes at the airport for the last couple weeks. You've been stepping up to help meet all of those entering our city and greet them and provide materials. This is something that a lot of the people aren't seeing because they're hunkered down at home, but please know that your work is appreciated by the entire community. For frequently asked questions and additional information, this is a reminder to all the individuals that masks are required in public places. Please remember to bring them with you if you need to go out of your home. Also, you should still maintain social distancing from other people, even when you are and aren't wearing your mask. It's also a reminder to people that the playgrounds are closed. We know this can be challenging, especially for those with children, but we believe this is for everyone's safety. So just a reminder, playgrounds are closed. Something good to pass along here. I'd like to take a minute to share that good news. Businesses are working hard. They're adjusting their business models and stepping up. They've got delivery pickup options. Some examples of those are AC Value is not charging for delivery. Baja Taco has rearranged its drive-through so it's easier for traffic to come and go when picking up orders. The Powder House brings orders to your waiting car. Thank you to those businesses, and we know there are a lot of other businesses out there that are making special accommodations, and we appreciate those positive adjustments for the customers. So in closing, I'd like to remind you that the next City Cordova update is scheduled for Wednesday. There will be a radio update broadcast at 1, 5, and 8 p.m. on KCDV FM at 100.9 on your FM dial, and at KLAM AM at 1450 on your AM dial. Also, there's a City Council meeting taking place at noon. That's a special council meeting, and you can listen live and on demand on YouTube on the City of Cordova, Alaska page. All information is available on our Cordova COVID-19 website at covid19.cityofcordova.net. Thank you, Cordova, and have a great evening.
All right. Mayor Copeland's presentation from yesterday, that was at 4 p.m., and if you would like to see that or hear that, really, you can go to the city's YouTube channel. I can't ever remember what their extension is, but I always just go to cityofcordova.net and click the YouTube link that they have there. Robbie may have put that briefing on our channel as well, so if you have ours bookmarked, we're youtube.com/Cordova TV. Now, you heard Mayor Copeland mention there is a special city council meeting today at noon. It will be live on the city YouTube channel and archived there, probably archived on ours as well. But if you want to participate in the meeting by offering comment, then you'll want to tune in to the city YouTube channel at noon. The public call-in number is 253-6202, and what happens when you call in is you're placed on hold, and you'll hear the on-hold music. And then when it's your turn to talk, your call will ring through in the order received. Now, a reminder again that what you see and hear on YouTube is delayed by sometimes a minute, sometimes a minute and a half. So if you are in the phone queue and you rely on hearing somebody on YouTube say, okay, it's your turn to talk, that's you're behind by, again, as much as a minute and a half. So while you're on hold, keep your phone on your ear or your headphone or whatever you use, but be listening through your phone. Don't be listening through YouTube for your chance to talk. And I've testified a couple of times, and it works well when you're on your phone, because what you'll hear is when it's your turn to talk, the music goes away, you hear a ring, and then through your telephone, you hear Mayor Copeland say that, or whoever's chairing the meeting, that it's your turn to talk. And at that point, it's also very important to mute your computer or whatever device you're using to listen to YouTube. So you listen on the phone while you're waiting. The on-hold music goes away. You hear a ring. You hear the chair say it's your turn to talk. At that point, mute your computer or TV or however you're watching, and then you get your 3 minutes. So that'll be part of today's meeting. And remember, these Wednesday meetings, if you want to personally maintain advance notice, I mean, they put these agendas out 24 hours in advance, as usual, unless it's a super emergency, in which case it can be 6 hours. But you can count, until further notice, you can count on there being a special meeting at noon every Wednesday. So these are, while they're technically special meetings, they're sort of a regular thing, at least for a while. Now, as far as what's on the agenda, the guest speaker from the incident management team will provide an update on how that team is responding, all the things that they're working on and preparing for. The incident management team, of course, is the group of folks that's headed by Paul Trumbley and also by Mike Hicks. And it includes doctors and various people with different talents. So they're going to give their update. And then another guest speaker is April Horton of Shag's Hair Studio, who I was looking at her letter. And by the way, all of the letters and all the documents and the packet information are available on the city website. Or we've got a pretty easy link to it on our website. If you go to CordovaRadio.com, go to our extras section, and then there's a download link for the agenda there, if you prefer. But if I remember right from April's letter, she's talking about preparation she's making to be able to start working again once that's allowed. And, of course, that's a question that has come up a lot because businesses see that in other places in the state, there has been a gradual, it's only about like 25% capacity, but there's been a gradual move towards starting to reopen parts of the economy. And Cordova has exercised its ability per the state's, permission, or I don't know. Anyway, Cordova has authority to delay that process, and that's what the city's position has been so far, is to not change things as far as how the businesses operate just yet. Because of the influx of population that's coming, I think they kind of want to see how that's going to go and impact things first. But it's an ongoing dialogue, and it sounds like April is maybe going to speak to that. So she's a guest speaker. And then there will be a CCMCA board report and school board report. That will be followed. CCMCA is the hospital board, what people refer to as the hospital board, even though they're more than that. And then the audience comments section will launch after those guest speakers and board reports. After audience comments comes the mayor's report, manager's report, city attorney report. They will acknowledge the correspondence. I don't think they'll probably be, excuse me. That's not, it's not, okay? It's not. It's not the thing. My temperature is 97.2. I check it every morning. I just need some water. Anyway, I don't know if they're going to read the correspondence. They haven't been. But you can look at it again by downloading the packet. And the correspondence includes the April 21st letter signed by 7 Cordova doctors, and that's the incident management medical team letter. That's been circulating for a few days. In fact, I think we read it maybe back on the 22nd on this show. So that letter's in the packet. Also, a packet from the Keeps Cordova Safe folks, which I think are the ones who were running the petition site. And, of course, that the petition itself is not valid anymore, but they've continued to post letters on their site that they consider to be of interest. So there's a letter from those folks, which, if I remember, is largely about strongly speaking to the need to enforce quarantines, but you can read it for yourself. And then the email and letter from April Horton is also in that packet. So those are the correspondence items. Then when they move on to new business, there's a resolution ratifying the temporary emergency rules and procedures as revised and enacted by the city manager in Emergency Order 2020-05. That document is also available for you to review if you want to before the meeting by downloading this packet for the April 29th special city council meeting. There is an approval of the school district's plans for the 2020 Cordova High School graduation. And I actually pulled that document from the packet. We're going to look at that in a bit because I'm sure people are wondering about that. There will then be discussion of COVID-19 emergency response before they move on to the pending agenda and calendar and have the second audience participation, followed by council comments and maybe an executive session. So if you would like to look at that agenda, you can get it from us, CordovaRadio.com in the extra section, or you can navigate to it through the city website, cityofcordova.net. Now, graduation. How are our local officials contemplating that? There's a letter in the council packet from Alex Russin to the city manager, which outlines the school's plan for graduation. And the local plan, according to this, we'll just read it down. Access to the building in order to pre-record the valedictorian and salutatorian speeches, along with individual students crossing the stage to retrieve their diplomas from a table. A photo op in graduation regalia will follow with direct exit from the building, tentatively occurring on May 9th. And then finer details that are still coming together. So again, keep that in mind. These are things that are being proposed. They're saying that all requirements and mandates and guidance will be strictly followed. Access to the gym will be limited to family members of a graduating senior, socially distanced by no less than 6 feet, if not in the same household, and staff as appropriate. No more than 20 individuals at any time in the gym, and the occasion will be videotaped. Each student will be on stage, wait for their name to be announced, proceed to center stage, at which point they'll pick up their diploma. There will be a photo opportunity with the graduating senior and their same household family members available as well. Families will exit the building immediately following, then the next family would come in and follow suit at the appointed time. To be clear, not all graduates and families would be in the building at the same time. Each family would have a designated time in which to enter the building and engage in the occasion throughout the day. The time intervals would allow for the district to maintain control over access to the building and the concern for social distancing practices, in addition to sanitizing areas as needed. Upon completion of the day, the video snippets would be spliced together and released to the public on the planned graduation day of May 16th. While COVID-19 has certainly put a spin on all our lives, especially for our graduating seniors last quarter of school, the district would like to be able to maintain some tradition for this, the centennial graduating class of 2020, hence the strong desire to use the stage as the backdrop to this milestone event in the students' lives. Russin's letter goes on to say, again, we'd like to be on the same page as the city and/or incident command team to avoid confusion, inaccuracy to the public, or other misconstrued notions that may serve us. Please let me know, again, speaking to the city manager, please let me know if you'd like to learn more about how we see this unfolding, or feel free to direct me to staff who we need to discuss our plans with in further detail. Of course, in the event CHS is being used on May 9th as a COVID-19 related facility, we would go to a Plan B location, which is still under consideration. We're open to suggestions and thoughts on the possibility of the North Star Theater, perhaps. I'm CCing our principal and maintenance director here to keep them up to speed on the plans moving forward. Thanks in advance for your response as we celebrate the accomplishments of our students. So, they'll be discussing that at the council meeting under new business. Now, why did I print this off? This is, I'm looking at the April 27th news release about the updated ferry schedule with the 4 vessels expected to resume service in June and July. But, you know, interestingly, this document doesn't even mention Cordova. And I was taking a look at the ferry website to see when sailings began and what they look like in July, and it's too depressing to elaborate on. So if you really want to see that, you can go have a look, but yikes. Never would have thought to see that sparse a level of service for a community not on the road system. So I don't even know why this is in my packet. Now, this is interesting. You might have heard that the state was doing some surveying on how things are going for families impacted by the shutdowns. And they put out a news release with some preliminary results. The headline is, Alaska's parents share concerns about how the COVID-19 pandemic is affecting their families. And also notes that the next survey has launched, which explores impact on physical activity and nutrition. So here's what it says. In just a week, almost 2,000 Alaska parents responded to the first survey in the Alaska Department of Health and Social Services series of family surveys to find out how the COVID-19 pandemic is impacting the lives of Alaska families and children. Alaska families are encouraged to fill out the second survey called Health. That survey is focused on the impacts of the pandemic on physical activity, nutrition, health insurance, and access to prescriptions. Alaskans can participate by texting the word health to 907-269-0344. Or if you don't like to operate that way, there is a link to the second survey and results from the first one posted on the DHSS website. If you go to dhss.alaska.gov, you can navigate to it. Or again, you can text the word health to 907-269-0344. This goes on to say the first survey in the series revealed that 3 out of 4 Alaska parents are concerned that the COVID-19 pandemic is negatively impacting their child's physical health. Even more parents are concerned about the impact on their child's mental health. Dr. Ann Zink, Alaska's chief medical officer, said, quote, daily regular physical activity can make a big difference in how your child feels right now. Physical activity improves your mood and eases stress. A simple walk can help you and your children feel less anxious and improve your sleep that night. End quote. Parents stated that spending time outdoors, 74%, increased family time, 70%, and connecting with friends and family online, 69%, have helped them deal with the physical distancing measures. DHSS also learned that of those parents seeking care, over half reported difficulties in obtaining medical care, 80%, and mental health care at 60%. The state reminds families that if they need help, they can call 211. And the state website has a number of links to various assets, something called Help Me Grow Alaska, Plan Every Day campaign, a link on how to be physically active safely during the pandemic. The Office of Children's Services has something called the Child Safety and Well-Being During COVID-19 website. Resources specifically for parents and caregivers of children with special health care needs are available on the Division of Public Health's Children and Youth with Special Health Care Needs website. Parents feeling overwhelmed can call the Alaska Care Line, 877-266-4357. There's also the National Domestic Violence Hotline, because, of course, nobody wants to see that ramp up during the lockdown. But, really, and you can, this news release is available on the state site, but the easiest thing to do probably would be to just remember that 211 number. If you call 211, then you can explain what you're looking for in terms of assets or support, and they can point you to it. News release goes on to say the second survey continues to explore challenges families are facing. Carol Fink, the manager of Alaska's Physical Activity and Nutrition Unit, said, quote, "We hope parents with children and youth at home will share how their children's physical activity, screen time, and dietary habits have changed during the pandemic." End quote. The Physical Activity and Nutrition Unit coordinated with the Maternal Child Health Epidemiology Unit to design the second survey. And again, if you want to take that, there is a link at dhss.alaska.gov, or you can text the word health to 907-269-0344. This is the town meeting program for April 29th. Very glad to have you listening on KLAM or on youtube.com/Cordova TV if you're hearing our delayed broadcast. Mayor Copeland mentioned this earlier in the show, but it's worth going over again here, I think, that the city of Cordova is currently looking for an emergency worker pool to fill some current needs as the pandemic continues. Further jobs may be added as needed, but right now what they're looking for are what they call port of entry ambassadors to greet incoming people to Cordova who can knowledgeably and physically distribute information and resources available to those newly arriving, including addressing the state and local mandates currently in place, all in order to keep our community safe. These ports of entry would include the airport and harbor areas. You need to be willing and able to approach the public directly and in person, be at least 18, have a valid driver's license, personal protective equipment will be provided, and hazard pay will start at $25 an hour. They are also looking for custodians to clean and disinfect the city's public restroom facilities located in the harbor and at the pool. Got to be at least 18 for that with a valid driver's license. You need to have initiative. Be physically able and willing to endure periods of exertion. Personal protective equipment and training from professional services will be provided. Hazard pay will start at $30 an hour. The city says they're hiring immediately and jobs will be filled as applications are processed. Cordova is an equal opportunity employer and a drug-free workplace. For more information, you can email Cindy Appleton at humanresources@cityofcordova.net. Again, that's humanresources@cityofcordova.net, or call 429-5126. Phone number again, 429-5126. You can also get a lot more information by going to cityofcordova.net. Find a link that says, "How do I?" ? Click the "How do I?" link and then scroll to Find a Job. The job announcement posted there will have a fillable application. Just fill in one of the two positions highlighted that you're applying for. These can be completed online and emailed to Cindy. Hard copies can be made available at City Hall, but you've got to call first because the building is locked, and that would be 424-6200. So pretty good pay and pretty important things to do if you're looking for something temporary, if you were made to be out of work because of the pandemic or have some extra time. And I'm sure that announcement is on the city's website somewhere. Just look for the emergency worker pool information. In other news, an announcement from the Salvation Army that there are needs at the food pantry. Not surprising. The Salvation Army Food Pantry is in need of community donations. They're looking for canned protein items specifically, like tuna, fish. I'm sure salmon would be fine. Chicken, beans, chili, ravioli, general canned protein. Any donation is greatly appreciated and can be dropped off in the collection box at the AC Values Center. There was also a document recently released by the Cordova Prepared folks with some guidelines for the use of cloth face coverings, which, as you probably know, is considered mandatory, with a few narrow exceptions for medical issues and very young people, but basically everybody else is supposed to be masked when you're out and about, if you have to be near anybody. And these recommendations include making sure that your face covering fits snugly but comfortably against your nose and the side of your face. You don't want to have any big gaps in it, or it isn't going to do much good. A face covering should be secured with ties, ear loops, or fasteners. Of course, if you're using a bandana, that doesn't work, but in that case, again, make sure it's over your nose and mouth, tied in the back, and that it can't slide down your face. Some people are also using these face coverings that mostly bunch down around your neck and then pull up, kind of like a winter warmth face covering. So if you're not into ear loops and want to use something that you pull up from the bottom, that's okay. Just, again, it's got to cover both the nose and mouth. Otherwise, it doesn't do any good. The announcement mentions multi-layer fabric as being okay, as long as it doesn't hinder your breathing, of course. And it should be sturdy enough to hand or machine wash and dry without damaging the mask or changing its shape. Other guidelines include remembering to not remove the face covering until you return home and then put it directly in a laundry receptacle. Otherwise, if you just take it off, set it on a counter, you could end up contaminating your home. And they say, too, when removing the face covering, avoid touching the front of it. For example, if you've got one of these ones that uses hair ties as ear loops, grab it by the loops and not by the front where you've been breathing or inhaling or anything. Wash your hands immediately after removing your face covering and before touching anything else. Wash face coverings in hot soapy water between uses. And this is the most important part of masking. Something that I've been trying to emphasize very strongly along with city officials. Do not rely on face coverings as the primary way to prevent COVID-19 transmission. And be careful to avoid developing a false sense of security through the use of face coverings. Continue primarily to follow social distancing measures, including maintaining at least 6 feet between yourself and others, staying at home as much as possible, avoiding touching your face, and washing your hands frequently. I'm glad to see this continue to get emphasized because it's clearly a piece of the puzzle that not everybody understands. If you can believe what you see in the chatter, there are people who, and it's not an entirely illogical thing to assume. Unfortunately, it's an uninformed thing to assume. Because what people are having a tendency to do in some cases is they think, oh, I'm wearing a mask. That means it's okay to get closer to people. That means it's okay to go out more. That means that I don't have to wash as often or, whatever. And the doctors and the scientists and the city officials and the host of this program are trying very hard to make sure that everybody understands that that's absolutely not the case. It's the protective, well, not protective, the protection that masks offer only works if you continue to otherwise behave like nobody had a mask. So in other words, before masks were recommended, everybody understood stay at home as much as possible. If you absolutely have to be out for essential stuff, stay 6 feet away from people, hand washing, blah, blah, blah. The introduction of masks into that equation doesn't change any of those other behaviors. It should still be primarily stay at home, social distance if you can't stay at home, wash hands, etc. And then on top of that, as an extra added bonus, wear a mask, because that helps to reduce the probability that you could pass the virus on to somebody else, particularly if you're asymptomatic and you don't know that you have it. You know, it's probably worth mentioning again that when this whole thing was first starting back, January, February, the initial guidance from the World Health Organization, and I think the CDC and just the experts in general, was for people to not rely on masks as a means to protect themselves, because, number one, a mask doesn't do all that much. Even the really good ones are not a guarantee that you won't catch it. And certainly wearing a cloth mask is not a guarantee that you won't catch it. It provides a little more protection than nothing at all. But the WHO and the other organizations were concerned that the civilians were going to be buying up all of the masks, thinking that they'd be safe, and there wouldn't be any for the people that really need them, like the hospital care workers and so on. So that initial guidance was directed toward people thinking that my mask protects me. What's happened as the situation has evolved, of course, and the epidemiologists got a better idea of how it spreads and all that sort of stuff, is mask wearing became not about my mask protecting me, but my mask protecting you. And that guidance seemed to evolve, incidentally, as probably the experts realized how many people were willing to make cloth masks so that people could be masked without eating into the supply that the healthcare workers needed. And so some revised guidance came out that said, yeah, masking is good. Again, not me wearing a mask to protect me, but me wearing a mask to protect you. Particularly the asymptomatic people walking around have no idea that they're carrying the virus because they're not showing any symptoms, but could still spread it because you can give this to somebody else just by having a face-to-face conversation with them within 6 feet. So again, it's a very community-minded action. Wearing a mask, even though it may not do a whole lot to keep you safe from others, it can do a fair amount to keep others safe from you if you're a carrier and don't know it. And that's why, for example, Cordova's mandates and emergency plans require the use of masks, except in very particular circumstances. You know, and that reminds me, that very particular circumstances component reminds me of something which, again, I know people may be sick of hearing about on this program, but we consider it very important. And it has to do with people not treating others badly because of something like masking, for example. We're still getting these stories where people are saying that they if they don't have a mask on in public, that people are driving by and yelling at them and cussing and being angry and threatening and basically verbal vigilantes. I don't know that anybody smacked anybody over it, and that really is, we should be better than that. We really should. There's just there's no excuse. I mean, I can understand where it would come from if somebody is really super scared or just really super wound up in general, but it would be nice for the overall tone of this thing if people would tone that down, and really on both sides. I mean, you've got some people who, because of a perceived constitutional stance or perception of rights, and I don't pretend to understand all of that kind of stuff, so I'm not going to comment on it. But there are people out there who will choose to just blatantly defy the masking mandate. They are subject to a $500 fine for doing that and a mandatory court appearance. The authorities, as has been testified to in council meetings, the authorities are going to lean very heavily on the education component. In other words, if somebody is not masked and the authorities approach them, they're going to ask why, to perhaps find out if that person is a diagnosed claustrophobic or maybe has asthma or, a legitimate reason that they're not masked while out doing essential stuff. The authorities will try to educate, try to encourage mask wearing, try to make sure the person understands the rules, and use the penalty as a last resort. For somebody that should be complying that just absolutely won't. I mean, basically it comes to a point where you're welcome to stand on perceived constitutional rights, whether they're real or not. The cost of doing that will be $500 on a court appearance. So if that's worth it to you, then that's worth it to you. On the other side of this, though, is people who give the finger and just generally treat people who aren't wearing masks badly with no idea whether they are not wearing one legitimately or not. I mean, it says right in the document, if you read the document, that there are exceptions. There are for very young kids, there are some exceptions written in there for people with certain medical conditions. I should have printed the thing off so I could read it, but I didn't. But there, I mean, you can look at it for yourself. So what I hope people will do is go easy on the assuming that somebody else's situation just based on some kind of external observation. A person not a person who is not wearing a mask is not automatically, one of these caricaturish, don't tread on me types. So they don't deserve, not everybody deserves to be put in that box just because they're not wearing a mask. And in the reverse, not everybody that is wearing a mask is some kind of a cowardly snowflake that is succumbing to the power of the government. Because the shaming can go both ways. Anybody walking down the street that sees a person in a mask and makes some sort of a comment that, hey, way to go, you fearful coward, boot to the head when you act that way. Just like the person driving by, the unmasked person saying, you don't care, all you care about is your rights and you just want to kill people. The whole extremism that some people show in the midst of this thing still kind of continues to baffle me. And that doesn't, I'm not saying that I'm some sort of a hero because I prefer logic and data to human behavior. For me personally, I don't get that. I don't get why people would want to act like a baseball manager fighting with an umpire over stuff like this when really community is what we need right now. There's enough to be concerned about and stressed about without people treating each other badly and putting each other in boxes and saying that because you seem to be doing a certain thing, therefore you are that kind of person. I mean, I'll tell you a personal story along that line that I had to go through yesterday. I was having a conversation with some friends on Facebook about sort of this same subject, about how it was basically I was speculating on whether people who took very aggressive stances earlier in this thing will be willing to back away from those stances if the data shows that the initial stance maybe was not entirely correct. Doesn't mean you were stupid to take a stance early on in the thing, but for example, when the death models were saying that 2 million Americans were going to die as a result of this thing and we need to shut everything down, I mean, if that's what the data is showing, shutting everything down seems like a pretty good idea. Now, what's happened is, of course, that model has been walked back from 2 million to, I think it was a few 100,000, and now it's maybe under 100,000 by a certain time. But anyway, the model step down. And, a question that I was wondering is, would the people who set policy based on that model, would they have the presence of mind to say, oh, this is interesting. Okay, the model's been updated in better data or with better data. So therefore, because the data's better, I'm going to rethink my position on it a little bit? Or will you have a bunch of egomaniacs out there that say, well, it doesn't matter if the model now says it's tens of thousands of cases compared to 2 million cases, we're not going to change anything. Because my worry about human nature is that, because you see politicians do it all the time, that if they took a strong position and then the situation evolves, it would be embarrassing for them to say, we shouldn't have taken this strong a position. It's time to modify. And that, of course, goes the other way, too. There were a bunch of people saying, this is being overblown, this is a hoax, it's only going to kill 500 people, and then, they discover, oh, no, okay, this is more lethal. It's different than the flu. It's not just the flu. It's happening over and above and on top of flu-related deaths and so forth. They take these positions early on, and then as the data evolves, do those people have the presence of mind to modify their positions in light of the new data? So that's kind of what I was talking about in this post, and having good conversations with people about it. And somebody came on and decided that one of the things that I was talking about, apparently she decided that was just a Fox News talking point, and which is, whether it is or not, I don't know, because I don't watch Fox News. I don't watch any national news. National news to me is garbage. That's just a personal opinion. I'm not saying anybody else should feel that way. I just right now, I mean, for the last several years, honestly, I've tried to focus on state and local news because I just can't stomach what is happening, especially on cable networks. You pick Fox or MSNBC or CNN or OAN or take your pick. It's not news. It's sensationalism and, an excuse to beat up on other people. But anyway, this person perceived that something that I said apparently resembled some Fox News talking point, some question that I posed, and unloaded on me and said, I'm so sick of hearing people talk about this. This is just a Fox News talking point, and blah, blah. I hate conservatives, blah, blah. And I wrote back, as I often do, I'm sorry, where is this coming from? Why are you saying that I'm just regurgitating Republican talking points by asking this question? And there was more bile, and so, I just eventually cut that person loose. Because, I guess we all have our trigger points. Some people are triggered by Trump. Some are triggered by Pelosi. Some are triggered by red states. Some are triggered by blue states. I don't really I'm very much in the middle on that kind of thing. But one thing that I do have a serious pet peeve about is being put in a box like that. You know, being a person who tries to think things through and balance my perspective as much as possible and looking at different perspectives. I make a serious effort to look at a lot of different perspectives on issues like this and stay away from pat answers and that sort of stuff. And so, you know, when somebody, if somebody is so shallow in their ability to engage in dialogue that the only way they can do it is to label and compartmentalize a person in order to engage with them. In other words, I have to have you in this box. I have to understand you in this context so that I can then yell at you, rather than, you know, taking a question, whether it's a left-leaning question or a right-leaning question that I put out there because I'm trying to learn more or whatever. If the best somebody can do is to lash out on a bunch of preconceived notions, I don't have time for that. And the reason I bring it up is I don't think there's really a lot of time for that in general in the midst of all of this. So that's the background on why I always try and encourage people to not treat each other so badly when they see someone that appears to not be conforming to their view of how things ought to be. And I really hope that the stories we're hearing about people who don't seem to get that are outlier stories and don't represent the bulk of what the community is thinking and doing. And I think that's probably the case. You know, extremists have a tendency to be louder and generate more attention, but they don't necessarily represent the population in general. So I guess to put a bow on it, I hope that all of us on whatever side of these issues are will ultimately remember that everybody's a human being and probably everybody's doing their best, and don't presume, any of us should avoid presuming that we can instantly diagnose where a person is coming from based on external observation. Now, of course, I don't want to end on that. So our grand finale for today will be akin to a bit of poetry. It isn't really, but just something that hopefully will make you smile or think positively. I don't even know where this came from, but it has to do with the fabric masks and the people who are making them and selling them for a little bit or giving them away or whatever. So let me just read this. If you've bought a fabric mask or received one for free, here's what you should know. That fabric has a story. It may have been chosen for a quilt that was never made, or perhaps it's remnants of a homemade Easter dress. It could have been passed from owner to owner or even bought with express intent to make a cool mask. Either way, the sewist, I've never heard that word, but I like it. The sewist assessed its mask worthiness and thought it would be perfect. The sewist who made it is tired. She's been sewing for days. She tires of the monotony. She's pricked her fingers with pins and sliced her knuckles with rotary cutters. Yet she continues to make masks for you. It was worth every penny. Whether you bought it for $5 or $15, you paid fair market value for someone's materials, time, and talent. If you received it for free, it's already been paid for with the maker's charity and hope. The sewist made it to help you, but it's helping her too. She decided the best way to work through this situation is to help those who protect all of us. The maker is being flooded with requests. People who haven't spoken to her in years are calling to chat and ask for a mask. She's being offered money to make more than she can handle. Sometimes it's enough, sometimes it's not. If she's got too many to make, she won't turn you down because she really wants to help you. It will make her smile when she sees you wearing it. She'll remember the fabric, the batch. She may even tell you it was one of her favorites. She'll smile knowing that she did this small little thing that's helping you in such a big way. She'll smile knowing that in the most difficult of times, she has a skill that so many will value. It should give you hope for a better world. In a situation where members of our community are struggling, others have risen up, offered their time and talents to provide what they can. It means there's hope for humanity supporting one another and that people truly do care for one another. End quote. I like that. And I like the fact that you decided to join us for the show. Hope it was of some value to you. You are welcome to share this program with others who have YouTube access. YouTube.com/Cordova TV is where this show can be found in a little while here after being done on the radio. Big thanks to Cordova Wireless Communications for the sponsorship. Remember, there is a special city council meeting at noon, and our daily briefings will be at 1, 5, and 8 p.m. Looking forward to seeing what we'll be able to bring you next. Any programming missed in the 10 a.m. hour will be brought to you next. And we'll look forward to having you for the next town meeting brought to you by Cordova Wireless Communications here on KLAM.